Hi, I'm Jesse Newman again, and here we go with another session of Consult with a Professional. Greeting you today from the beautiful Brazilian Court Hotel in Palm Beach, and there's a reason why. Because my guest today is Dr. Fred Barr, a noted plastic surgeon here in the Palm Beach area, and he's here, believe it or not, and don't say you've never heard of a doctor in Palm Beach making a house call. But it just so happens we got him on the run. He's got a patient here at the Brazilian Court who's recuperating from plastic surgery. And Dr. Barr, I'm glad I caught you, and good day to you, and it's great to have you with us.
Good morning, Jesse. Thank you for having me here.
Now, Dr. Barr, one of the main questions I've heard is, does it hurt, and will the scars show? How do you think we can tackle that subject?
I think it's easy. I think what we need to do is, first of all, be honest with our patients. Obviously, any kind of surgery, there is going to be some amount of discomfort to that procedure. Hopefully the discomfort will be minimal. Hopefully the healing process will be a satisfactory one. The scars, of course, will be there, but we'd like to make them as inconspicuous as possible. Fortunately, Jesse, as you say, this is one of the happier, can be one of the happier aspects of the surgery that I, as a board-certified plastic surgeon, perform. And therefore, when patients are pleased, it makes me pleased as well.
Will the scars show? Now, how do you satisfy somebody who's worried? And let's face it, vanity does enter the picture when it comes to plastic surgery. And if you're going to do something with my face, whether it's the eyes, the nose, the chin, or whatever, I might be concerned as to whether the scar shows, because I might not want anybody to know that I'm doing it.
I think if you have the feeling that you're concerned with others, you should really evaluate what your motivations are, because this surgery really is for you. If you are concerned as to what your appearance will be for others, if that's your main motivation for doing the surgery, I've got some serious doubts as to why you are doing the surgery, Jesse. And one of the things that we do talk about with patients is that this is surgery directly for you. It's not going to change anything in your life except how you feel about yourself. As a side effect, as an added side effect, you will get hopefully good response from those around you, but basically this is surgery directed to and for you. Scars are there. Again, what I said before is that we will try and make them as inconspicuous as possible, but it would be foolish to believe that we had a magic wand and we could do things in surgery that just do not have any effect from them. That would be foolish thinking.
Now, another question, and I'm sure that you'll need a crystal ball to answer, is one of the ones we've received many of. The question is, what do I look like after surgery? Now, of course, it's a tough question, I know, but yet it's on people's mind. Will they look better? Will they look different? Will they be recognized that they look younger? Or what's been your feeling on that?
What I try to counsel patients, again, is that aside from the surgery being for you, obviously we can't take you back to when you were 20 or 25 years of age. Boy, I wish we could. It would be great. What we can do is we can improve what you have. If surgery is done properly and healing is successful, surgery can improve the dimensions of your face. Again, now, the cosmetic aspect of this is really interested in the skin and soft tissues. We're not dealing with bones per se, so we're not changing your bone structure, but we are what's called redraping the skin and soft tissues. Some surgery is performed to do the bone structure, such as if you're having a nose surgery performed or chin advancement or recession. Those are things where the bone can be involved and the architecture can be changed. However, the majority of the facial rejuvenation or cosmetic surgery is really dealing with the soft tissues and skin.
Tell me, Dr. Barr, what is the most popular plastic surgery that you perform? Is it on the eyes, or is it something with the nose?
Well, today what I would like to talk about is the area of facial rejuvenation. And in the area of facial rejuvenation, there are many areas that are popular. As you mentioned, the eyes are very popular. Probably the biggest or largest percentage of patients that come in for surgery of the face involve the eyes and eyelids themselves. The nose is also very popular. There are two areas in the younger adolescent age and also in the older age. Face lifts are also very popular, as well as forehead lifts. The advent of fat injection now for wrinkling around the face and in the mouth areas has also become very popular. So I think there are a multitude of areas in facial rejuvenation that can be looked at, and this is something that each patient really needs to think about in counsel with their qualified surgeon to really discuss, sit down, and honestly talk about.
Now, you make, at least you try to make, wrinkles disappear. And this is probably very important to somebody in the aging area when they pass 40, 45, a woman or a man, and they're concerned with wrinkles because wrinkles indicate the approach of elderliness, whatever you want to call it. But the approach of wrinkles is bothersome to many people. Do these wrinkles that you make disappear? Do they come back?
Okay. First, let's talk about disappearing. Again, if I were a magician and I had a magic wand, I could make a vanishing act. Unfortunately, the reality is that we do not make anything disappear. We can improve, and we can dramatically improve things. But to think about disappearing acts is only for magicians. And unfortunately, I'm not that talented to be a magician. I'm just a surgeon. However, when we are able to improve the areas, we can get some very dramatic improvements. Surgery does not last forever because what is happening is we're fighting the effects of your genetic background, which will program how you age. We're fighting the effects of gravity, which is going to be with us until the laws of nature change, and we're fighting the effects of time. And what we are able to do is work with these factors the best that we know how with the techniques and skills that we have to try and improve what is. There's nothing in life that is guaranteed, or nothing lasts forever. And unfortunately, this as well fits into that category. So we try and improve. That's our goal.
Trying to remember my list again, many questions came through Dr. Barr as to where the surgery is performed. Is it performed in your office? Or I'm sure it could be. Is it performed in a hospital? What's the usual procedure?
My feeling is that I perform most of my surgeries in the hospital. And the reason I do this is I feel that the safety of the hospital, including the anesthesia, the monitoring of the heart and lungs, the post-operative care if needed, if the patient should need to stay overnight, all of the facilities are best done at the hospital setting. That is my own feeling on it. I do not necessarily have the patients stay overnight, but the availability for that is there, and I feel the safest area is the hospital setting.
Well, you know, you say the hospital, but then that might be a deterrent for someone to go and proceed with plastic surgery because it's not covered by insurance. Usually a plastic surgery is an elective, and I think that insurance companies will not pay for it. So therefore, it could be considerably less costly if it was done in your office, if it was something that would be like the eyes. Could it be done that way? If somebody brought up the subject of financing, would they be just as safe in your office as they would be in a hospital?
I think that we're broaching on a very dangerous area, Jesse, and the reason that I say that is the following. If you are looking at a procedure for cost, and if you're willing to take shortcuts on safety, then I, for one, am very unhappy with that attitude. I'm not saying that everybody has to be financially independent to have cosmetic surgery done. But what I am saying is that when you are considering that it is your life and the safety of your welfare and how you are and whether or not you can have a tragedy, which we certainly don't want to see, the best place possible, I feel, in my opinion, is the hospital setting. I don't think that finances really make an issue. Most of cosmetic surgery, as you mentioned, is not covered by insurance, and therefore the issue of the hospital, whether or how much more that is, that's something that we discuss at the time of the consultation, but I really feel in my own heart that the safest place is the best place, and I don't want to cut any corners for my patients.
Well, you see, the answer to that question only could come from you. It's come up, and I don't think, what's the average, one night in the hospital? Is that what about?
If that's needed. Oftentimes, for many procedures, the the stay is not necessarily needed overnight in the hospital.